Cerebral palsy is a group of disorders that affects a person's ability to move, maintain balance, and posture. It's caused by damage to the developing immature brain or an abnormal development of the brain as a child. The symptoms of cerebral palsy can vary from person to person and could range from mild symptoms to even very severe symptoms. These include a delayed developmental milestone, which generally means that you notice that your child doesn't start to do certain activities the same time his peers, friends, or siblings started. For instance, you might notice that your child doesn't sit at 8 months, or he's not able to hold the head at 4 months. You might also notice that your child has a preference for either the right or the left hand before he's 1 year of age. Something else that's important to note is that with cerebral palsy, the child might have fidgety movements, stiffness, might be floppy, which means your child is very weak or lax, and that your child might have feeding difficulties. There are different types of cerebral palsy. We have the spastic form, which is generally characterized by stiffness or exaggerated jerky movements. You might notice that the child also has an abnormal walking pattern and might also have contractures. There's the ataxic form of cerebral palsy, which usually presents with shakiness, tremors, and the children generally have a wide gait, which means they spread their legs apart while walking. There's the athethoid form, which generally is characterized by involuntary movements in the face, in the torso, or the limbs. And the tone of the muscle generally changes from hypotonic to hypertonic. And there's the hypotonic form of cerebral palsy, where the child is extremely flexible. Generally, patients or parents complain that the child's joints can move almost more than 180 degrees. And then there's the mixed form, which has a combination of all of these symptoms. Several factors put a child at risk of having cerebral palsy or cause cerebral palsy. And this could be before birth, during birth, or after the child is born. Before birth, if the mother had any infection during pregnancy, such as chickenpox, measles, or CMV infection, the mother could pass this infection to the child. Multiple gestation, having twins, triplets, or even more children at the same time can predispose the child to cerebral palsy. Infertility treatments and assisted reproductive technologies have also been associated with cerebral palsy. During birth, if there is a detachment of the placenta, or a rupture of the womb, or low birth weight of the child. Jaundice after birth, infection, or trauma after birth can also increase the risk of having cerebral palsy. Cerebral palsy is preventable. It's important to report any infections or fever during pregnancy to your doctor. Avoid alcohol, smoking. Know about your rhesus group so you could be aware of any form of rhesus incompatibilities. Control any underlying health issues that you might have. And report any new changes you notice in your child immediately to your doctor. Cerebral palsy cannot be cured. However, it can be properly managed to ensure that your child has the highest possible outcome. This usually takes a multidisciplinary approach, which would involve a pediatrician, a physiotherapist, dietitian. You might need to see a speech and language therapist, occupational therapist. In some cases, we'll need to place your child on some medications. If your child is having seizures, we'll need to place on anticonvulsants, some muscle relaxants if there are stiffness, and the child in some cases would require surgery. If you notice symptoms of cerebral palsy or you have questions, see a doctor immediately.